When I first started in fellowship back in the 80s, the upper age limit for patients undergoing allogeneic bone marrow transplant was about 50 years of age. And now the upper age limit is well into the 70s. And really it's not a matter of age so much as comorbidities. So for example, at our center, we just transplanted a fellow who's 71 years old. He's a rower, he plays clarinet in a band, and he remains very active. He's probably in better shape than I am. And he underwent an unrelated donor allogeneic transplant for myelodysplastic syndrome. We wouldn't have dreamed of that 20 years ago. And part of it is we adjusted our regimen. He received a reduced intensity regimen. So far he's doing well. But it points out the fact that age is really not a barrier to transplant so much as comorbidities. So for example, a patient with underlying kidney disease, heart, lung disease may not be able to undergo a transplant because those comorbidities will prevent them from being able to go through the rigors of a transplant. And so you could have a 40-year-old who has severe cardiac disease who's not going to be a good candidate for an allogeneic transplant. You could have a 70-year-old who's a fine candidate just based on comorbidities.